Hi, my name is Saif Gallagher. I am a plastic and reconstructive surgeon based in Indiana. Today's question I'm answering for our male to female patients who are contemplating undergoing bottom surgery is all about orgasm and sexual function and sensation after bottom surgery. So obviously this is a huge concern for both the patient and the surgeon. We want to make sure that your results after bottom surgery are as aesthetically pleasing as possible, but obviously it has to be functional. So what I would say straight off the bat is this has been studied before, and bottom surgery is a nice surgery in that we tend to get very good results when it comes to sexual function. And indeed, in the literature, when we look at satisfaction scores, patients, once all is said and done, oftentimes tend to have very high satisfaction scores after bottom surgery, after they healed. So we're seeing about 90% of male to female bottom surgery patients have good scores when it comes to sexual satisfaction. So I oftentimes ask our medical students, for example, when they see bottom surgery for the first time, well, what do you think the likelihood is that a patient is going to be able to have an orgasm after bottom surgery? And they're often very surprised to find out how good it is. So the reason behind that is when we are doing a penile deconstruction, we keep as much of the important parts as possible. So mainly the only parts we're getting rid of is that tissue that causes the erection, and we're also shortening down the urethra where a patient pees through. Other than that, we're preserving pretty much all the nerves, and the really important nerves from an orgasm point of view are the nerves that go to the glands of the penis, which are now becoming the clitoris. So those nerves are pretty much all preserved, and oftentimes they'll make the transition very well. Sometimes the patient may get some numbness, maybe on one side of the clitoris, but that tends to be temporary after surgery. So during recovery, obviously very few patients attempt to try and have an orgasm for multiple reasons. You're feeling gross, obviously you just had surgery down there, and particularly for patients who've had an orchiectomy at the same time, you're kind of doing the hormone roller coaster also. I would say the earliest we've had a patient orgasm after surgery is probably about 2 weeks after surgery, and then some other patients do take a few months to be able to settle back into using their new anatomy. But it's certainly, just like dilation, part of your homework. If that's what you want to do, you have to figure out what works for you also. Patients report a wide range of experiences. I would say overall patients tend to report very positive experiences. Some patients report better orgasms afterwards, different orgasms, maybe full body orgasms. It's just highly variable. And what I would say the best way to predict whether or not a girl is going to be able to have an orgasm after surgery is whether or not she's able to have one before surgery. So with regards to sensation, oftentimes when we do the labiaplasty, and just like any time we put a scar in the body, anywhere else in the body, there can be some numbness initially around that scar. This tends to go away with time, and pretty much at a year, sensation tends to be fully back. So overall, bottom surgery for our trans feminine patients tends to be pretty good when it comes to sexual function and results from that point of view. It tends to be a pretty good surgery.